Okay, hi everyone. So this is the second video I'm going to record to help you review for your Unit 4 exam. In this video I'm going to cover Unit 4.2, so this is heart rate, blood pressure, and EKGs. Before we started 4.2, we had done a modeling experiment in class where you were supposed to build a pump that simulated the heart. So if you remember, I asked you to model atherosclerosis with your pump, and you did that by adding a clamp to your vessel, which increased the pressure inside the tube, and it also slowed the flow of blood when you were modeling that. The reason why this models atherosclerosis is because when you have atherosclerosis, there's a buildup of fatty deposits that occurs inside the blood vessels. So what that's going to do is it's going to reduce blood flow, and it's also going to increase the pressure inside of these vessels. Now, when we started Unit 4.2, we got a new medical history for Anna Garcia. All of the things listed here were discussed in that medical history. So at this point, you should be familiar with the idea that diet high in calories and fat is going to increase your risk of atherosclerosis. Exercise decreases that risk, and a blockage to the coronary artery can cause heart attacks. So you looked at Anna's angiogram, and an angiogram is just a medical test where we inject a dye into the arteries, and you can view the location of a blockage. So in this case, the coronary artery, which is the artery that supplies the heart muscle with oxygen, has a blockage. You can see where it's narrowed right here, that blood flow is restricted because there's a plaque buildup on her arterial walls. Okay, so if you are at risk of heart disease, some things that a doctor might want to look at is, first of all, your heart rate. So we measured our carotid pulse in our neck, we measured our radial pulse, and then you designed an experiment to test what the effect of an independent variable of your choice would have on heart rate, and you wrote a lab report for that experiment. Now, because we were not at school, I just asked you to do it manually with your fingers. So you tested carotid or radial pulse. If we were in school, you could also use these automatic heart rate sensors. So this is what they use when you go to visit a doctor. It's in your iWatch. A lot of like the Android phones have the thing where you can place your finger on the phone and it'll take your pulse automatically. So there's both manual and automatic ways to detect your heart rate. Okay, so when we look back at Anna's medical history, you're going to see that it also lists that she has tachycardia. So tachycardia just means an elevated heart rate, so anything over 100 beats per minute. For an adult, it should be around 80 beats per minute. Reasons for an elevated heart rate might be because of that restricted blood flow. So again, that's pointing us towards the idea that she could be at risk of atherosclerosis. Okay. The next thing we looked at was blood pressure. So I asked you to virtually measure blood pressure. You were listening through the stethoscope on your computer to detect systolic and diastolic readings. How this works is when you go to the doctor's office, they often will put a cuff around your upper arm. And that's because the brachial artery is right here. It's located right here. And that's a good place to measure blood pressure. So what happens is this cuff, which is called a sphygmomanometer, you need to know that word, sphygmomanometer, that is placed over the brachial artery and inflated to restrict the blood flow all the way. So at that point, there is no blood flowing through your brachial artery. A stethoscope is then placed between that sphygmomanometer and your brachial artery. And as the pressure is released, you can hear the point at which the blood starts to be able to flow through that artery again. So that's the maximum pressure that still allows blood flow to start pumping. Okay? So you'll hear thump, 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 thump. That's your systolic pressure, the point where you start hearing those thumps. Now, the point where you stop hearing those thumps is when the artery is open enough to just allow normal flow. That's your diastolic pressure. So it's going to be two numbers when you measure blood pressure. It's going to be systolic over diastolic. Normal blood pressure reading would be 120 over 80. Okay, so the reason you have two numbers is because when your ventricles contract, that makes the big gush of blood. So that's what's causing that noise, that thump thump noise through the stethoscope, is your ventricular contraction. So that's the systolic contraction. Diastolic is when your ventricles are relaxed, so the heart is filling with blood. So that is going to be a lower pressure value because it's relaxed, it's not contracted. Here are the values that you would use to interpret those blood pressure readings. So normal blood pressure would be somewhere about 120 over 80. It should be that or lower. You are considered to have pre-hypertension if your systolic value is between 120 and 139 millimeters of mercury, or if your diastolic value is between 80 and 89 millimeters of mercury. Okay, so then there's stage 1, stage 2, and stage 3 hypertension. Hypertension just means high blood pressure, and these are the values that would qualify you for those different categories. So if you are higher than 180 in your systolic reading, or if you are higher than 110 in your diastolic reading, that's considered a medical emergency, okay? So that would mean that that pressure is so high that you are in danger of heart disease affecting you imminently. Okay, so why would your blood pressure be high? Again, that's going to lead us back to atherosclerosis. So if there's some sort of buildup in your vessels, that would cause an elevated blood pressure. So we know that Anna does have a high blood pressure. She's 142 over 85, which puts her in stage 1 hypertension region. When she was exposed to a stress test, so the doctor asked her to run on a treadmill. During that time, her blood pressure went up even more. She has a family history of uncontrolled hypertension. And also, they noticed that her left ventricle on her angiogram was slightly enlarged. So remember, the heart is a muscle. If the heart has to work overtime because the pressure is so high and it has to get that oxygen, those nutrients to your cells, then that would be a reason why the left ventricle may be enlarged, because it's working much harder, right? Okay. So the last part of 4.2 was EKGs. I asked you to first map out the different electrical systems in the heart. So at this point, you should know that the sinoatrial node is called the pacemaker of the heart. So this is what initiates the electrical signal to cause a heartbeat. The SA node sends out that electrical signal. You can see these arrows, and that causes the atria to contract. After the atria contract, the AV node, atrioventricular node, so that means between the atria and the ventricles, the AV node receives the signal, sends it down the bundle of His into the left and right bundle branches and out the Purkinje fibers. So this is that branching thing down here. And that's what causes the ventricles to contract, or depolarize is the other word that they might use. Okay, so we're going to take a closer look at that. SA node, again, step 1, the pacemaker sends out the signal, causes these atrium to contract. AV node picks up that signal and sends it down this pathway, and that causes the ventricles to contract and push that blood out to the body or to the lungs, depending on which side of the pump it is on. Now we can use an EKG to measure that electrical activity in the heart and detect abnormalities. Now the P wave corresponds with atrial contraction. So when the atria depolarize or contract, when they receive that signal, that's going to correspond with this P wave here. The QRS complex represents the ventricular contraction, so QRS. You can see it's much larger than the P wave. That's because the ventricles are bigger, and that's a bigger signal that you're going to be able to detect in the EKG. When the ventricles are relaxing, that's called ventricular repolarization, and that corresponds with the T wave right here. So again, each step is broken down here. P wave equals atria depolarizing. So right here is that hump, that P wave. Then there's a bit of a gap while the signal is reaching that AV node and down the bundle of His. Then the ventricles contract, that's the QRS complex. And then finally the ventricles need to repolarize. So that's ventricular diastole, so that's the relaxation phase. That's your T wave at the end here. This diagram is just going to break down each step, so if you feel like you need to study this some more, I would go ahead and read through these slides. Okay, so at this point we've covered everything that we need to understand the things that are listed in Anna's medical history. So the slight heart murmur could be detected with an EKG. The premature ventricular contractions, which means that her QRS complex is happening too early, it's premature, so you could also read that on an EKG. And then she also has slight mitral valve regurgitation. So if you remember, the mitral valves are there to prevent backflow. If she has regurgitation, that means that the mitral valve isn't closing all the way and there's some blood spewing back into the atrium during that ventricular contraction. So that would again cause a problem because you're not getting as much blood flow as you should out the aorta to the body. Okay, so that is everything that you need to know about heart rate, blood pressure, and EKGs. If you feel like you need additional support, then definitely join me for office hours from 11 to 12 today or any day. Okay, good luck.